Hi, this is Southampton Town Supervisor, and welcome to a special edition of Talk of the Town. We are talking primarily about coronavirus and its impact on the community, and we're here with Jesse Warren, the newly elected mayor of Southampton Village, because this is not just affecting the town, it's affecting all areas of the town, including the incorporated villages. And welcome first, Jesse, to the show. We'll maintain our social distancing here, and to viewers at home, we understand the great inconvenience that some of the measures we're taking are having on people, but we are really doing everything to try to protect the public, particularly vulnerable populations like seniors, those with compromised immune systems, those with respiratory issues, and we are doing our best to slow the spread of this virus with the hope that our hospitals can catch up, with the hope that the testing availability will catch up, with the hope that at some point there'll be a vaccine available, and those who have managed to not get this virus will then be able to be vaccinated to protect them. So this has been a real challenge. It's got to be, Jesse, for you as a sort of a newcomer to elected office. I've been in elected office for 20 years now. And for you, this has got to be coming out of nowhere. So you're hit with this crisis. Here you are managing a municipality, a village. The schools are closed. The hospital is frantically getting prepared. You've issued an executive order in the village. Can you tell us a little bit about that emergency declaration, what it entails, and why you chose to put it in place?
Absolutely, a few things. So, Jay, you mentioned that this did come out of nowhere. It was a surprise to most people. And while I have been in office for 8 months or so, which pales in comparison to your level of experience, this is new to everybody. So it doesn't matter whether you've been in office for 8 months, 8 years, 8 decades. This has been an unprecedented challenge for everybody. And the best thing that we could do is really be proactive, over-communicate with our residents, let everyone know what exactly is going on, what actions we're taking, go to the public like we're doing now, and try to reach out to everybody and do what we always do, which is hear the needs of our residents and make sure we're delivering for them. And also, one job that I think is extra important for us is to communicate the importance of the social distancing that we're speaking about, optional self-isolation in your homes, and encourage everybody to follow the executive order that the governor passed yesterday, which closed restaurants except for takeout and limited public spaces for 50 people or under. Those things are critical. Like your police department, our police department will be enforcing the executive orders that are coming down from the governor's office. And to get back to your question, as far as
your executive order,
we issued a state of emergency yesterday. We did so in tandem and in unison with your team at town. And the goal, as of now, was to do it as a precautionary measure. But what that does is it allows us to have more advantages when we procure supplies, when we make decisions as far as expenditures go. We could suspend local laws. We haven't done any of that yet, but we could do so if need be. And so it just gives us more flexibility. But again, the state is already under a state of emergency and the county is already under a state of emergency. So this was really just a small extra step. And we didn't need to rush into it, given that we already had the 2 state emergencies.
So now, is Village Hall is closed to the public, right?
That's right. Village Hall
is
closed.
The Village Board of Trustees, are they still meeting?
So we had one meeting before we closed. What I'd like to do is I'd like to do what some of the teachers are doing. They're using a program called Zoom to do remote teleconferencing. So we haven't decided yet whether we're going to meet in person. My strong preference is that we do it via teleconference, via Zoom. I'd also like to have our trustees use another program called Google Hangouts, which a lot of people know about, which will allow us to,
What about the public? Are you doing any provisions where the public can make comments to their elected officials during those meetings? Is there any provisions for that?
The public can, via this teleconference, they can actually participate remotely as well.
So you don't have the ability to live stream from Village Hall, right, on Channel 22. I know we cover your meetings. I would offer this space to you for your meetings if you wish. I think you could do adequate social distancing, but one thing that would allow you is to go live. And then people, if they want to text or email or whatever it might be, and I would offer that to all the villages, if they want to have a meeting where the public can view. Now, you can do it through the internet. There's no question about that. But if you wanted to use Channel 22 for your meetings to go live, I would have no problem with that. I'm not sure how CTV will feel about it, but I think that they'll work with me during this crisis period on doing that. Let me ask you too, your other boards, you have zoning boards and architectural review boards. Have they been suspended during this emergency period, or are they doing a similar thing with their meetings?
We have postponed our land use boards, architectural review board, ZBA, planning boards for at least 2 weeks. In 2 weeks, we're going to address that situation. But for now, we're postponing them until we can get a little more clarity as to what exactly is going on. And again, a lot of our members of these boards, some of them are seniors, some of them have their immune systems compromised, just given pre-existing conditions. So we want to make sure that for all members of our village and our boards, that we put them in the safest possible situation.
Okay, now what about your parks, parks and playgrounds? Any decisions there?
Playgrounds and some parks are closed. Unfortunately, I was speaking to a lot of residents who love our dog park. For those who don't know, we have an excellent dog park on Windmill Lane. We are looking forward to reopening that as soon as possible, but to maintain social distancing and for the real safety of our residents, we opted to close the dog park. And then we also opted to close the park at Agawam Park simply because it's my understanding from various commissioners of health that children actually could be carriers of the coronavirus, but because their immune systems are not as strong, they actually are asymptomatic, and therefore they could be carrying the coronavirus and they could be actually infecting their parents or grandparents. So we actually want to keep, playgrounds like that away from.
My understanding is the virus can stay live on a plastic or metal surface for, 24 hours, maybe longer. So, we and our staff, I decided today also to close playgrounds. Our parks are remaining open. I want people to get fresh air and recreate, keep that social distancing minimum 6 feet, but walk on the beach. It's a perfect time to go for a walk on the beach. But because those surfaces can be sources for people to contact the virus, and as you said, to give it to their parents or grandparents, I think it's prudent that we shut the playgrounds. It's sad to do that, but I think during this state of emergency, and we have a 2-week declaration as well that may get extended, likely will get extended. It's interesting, Jesse, because you mentioned Agawam Park, and I love going to the concerts there in the summer. You guys do a great job, and it's a wonderful facility. And it was really just a few weeks ago we were talking about the park. We were talking about improving the water quality in Lake Agawam. We were talking about how do we get more businesses downtown. How do we, put in sewers or whatever it might be so we can get more cafes and restaurants, and today the park is closed. The bars and restaurants are closed except for takeout. I mean, what a radical difference just a couple weeks have made. I mean, how does it feel? And I know you're a business person, right? And you've talked very much about how to support local businesses. And you have, I think, 2 retail shops.
That's right.
in the village, and they're still open, right? There's been no decision yet to close retail. This has got to be devastating to our businesses, our business community, our restaurants. All the people make their living on tips, serving meals at restaurants. I mean, how, people still have to pay their rent. People still have to make their mortgages. It's going to be very difficult on our community in so many ways. Do you want to take a moment to respond to some of those issues?
Absolutely. I'd love to respond to those issues because I'd like to communicate to those who are watching today a couple of things. First, you asked about the business that I run. We have 2 stores on Main Street and 1 in East Hampton. We have made the decision, as a private business owner, to actually close our doors to the public. We're going to do what the restaurants are doing, which is if anyone wants to pick something up, they can do so, or we can deliver it to them without interacting. But we did want to set an example to the business community that it's important to do this because the phrase that everyone's hearing right now is called flatten the curve, which means that the more we can self-isolate and avoid the spread of the virus, actually the faster this will be over. And on top of that, it will give our hospital systems and other emergency systems more time to respond, more time to get more beds, more time to space out the people who will get infected. But this is a new reality. Now, the only silver lining here is that in other spreads of other pandemics, we will get through this. It's just simply a matter of time. So the faster and the more effectively we can isolate ourselves, the faster and more effectively we will reduce our risk and get through this. But the only thing I'll say is this is extremely devastating for small business owners, but even more so, it's devastating for everyday people who are paycheck to paycheck, who are working people, who are single parents, who simply want to go to work, get their paycheck, support their families. So this hits everyone hard, but it's actually almost unfair in the way this hits working class people and single parents and new families the hardest, because if you can't go to your job, you are not going to have your paycheck. And if you have rent to pay, if you have food for your kids, you're in a very tough situation. Now, on top of that, if you are a parent or if you have a few children, your kids are now home from school. So what that does is that you can't go to work anymore because you have to watch your kids. And so that puts you even in a more precarious situation. So what really government needs to focus on, and we can do what we can on the local level, and I'll explain what we're going to try to do there, but this really needs to happen on the national and state level. We need to be looking out as much as possible for, everyday people who are just trying to go to work, get their paycheck, and support their families, who don't have the savings that maybe other people might have, and who have families. So this is a very precarious situation. Again, we'll get through this, but we're going to look for leadership on all levels of government. There's some things that we can do on the local level to help, which we can maybe get to on this show.
Right.
But that's what I'm most concerned about.
These
and that's
measures, these extreme measures to sort of shut down society and keep people at home, I believe are the right thing to do for public health, but they will be devastating economically, and we will have to step up. There are a lot of people who live paycheck to paycheck out here. Very people of modest means. They have no savings, as you said, and they can't weather this. It'll be worse, for them. The young people, the virus, probably won't be that challenging for. Hopefully, they'll, if they do contract it, they'll have minor symptoms and get through it. But the economic impact of this could be very long lasting for them. If they're running up credit, now they have to pay those, interest costs and, late fees and penalties. It could be devastating. So, we're going to be wrestling with this for a long time. The president was on saying, it could be July or August before this washes through. I don't know whether that's optimistic even. We may be with this for a while. I know the travel ban has affected a lot of the hotels. A lot of European travelers come here for the summer and they're canceling their reservations. And in fact, one hotel asked me if I could find out some information about the Small Business Administration, because the president had announced that there would be loans.
Yep.
And and I haven't been able to get any information about the availability of loans to help them get through this. So, we're going to do our best to be a community and to address some of these economic concerns as well as the health impacts. In terms of health impacts, there were 2 positive cases that we know of within the town of Southampton. I don't know of any in the village.
Yep.
I'm trying to get more information. It's been very hard even for me to get information. All I've been told is one is from Southampton.
Right.
And I don't know what part of Southampton. That's confusing, because is it the town of Southampton? Is it the area of called Southampton that's outside the village? Is it within the village? I'm pretty sure it's not in the village. And then one, that's a male. I don't know even the age. And there's a woman who tested positive who is from the Hampton Bays area, and I have no information there either. And of course, the public wants to know these kinds of things. It's the health department's responsibility to identify all the contacts and to make sure that they know about it, and so that they can quarantine themselves, anyone who's in close proximity. We have reached out to assist the health department through our police department, saying, we are here too to help you. We know the Suffolk County Health Department's overwhelmed. There are now, let me see, as of yesterday, there were 74 cases
Yep.
within the county. And I think this is public information in terms of the breakdown. So there were 10 in the town of Babylon, 10 in the town of Brookhaven, 2 our neighbor to the east in East Hampton, 17 in the town of Huntington, 7 in the town of Islip, 1 in Riverhead Township, none on Shelter Island, 3 in Smithtown, 2 in Southampton Town, and 22 in Southold.
That's right.
There are 10 towns. Those are in alphabetical order, if anybody's wondering why I did it in those order, in that order. Boy, the North Fork has a real issue already with 22 cases. South Fork has a total of 4 cases, 22 on the North Fork. But of course, those 2 communities, there's quite a bit of travel between the 2. People go through Shelter Island on the ferry. We have workers who live up in the North Fork who work on the South Fork. We have a county bus, the S92, that takes people from the North Fork all the way out to Montauk, so from East Marion or Orient Point, all the way through to Montauk. So I did ask the county, if you were on that call with me, about what measures they're taking on the county bus to reduce the likelihood of the spread of the virus. So this is challenging, and within each town are villages. You're the mayor of the village of Southampton, but we have West Hampton, we have Sag Harbor, we have smaller villages like Sagaponack and North Haven, Quogue. So, I'm in constant communication. Today I have a call, you'll be on it, with all the supervisors and mayors. I've invited Assemblyman Thiel to be on that call too. I'd asked Legislator Fleming from the county and Legislator Krupski, the other county legislator for the North Fork. They're in session today, so they won't be able to be on that call. And we have some issues that are unique to the East End, and some of them are the testing issues. We want to make sure we have an East End testing site. Also, with the courts closed, they are directing all of the arraignments to happen in Central Islip. That's a tremendous inconvenience to us. So we're trying to get a location for East End arraignments, hopefully in Riverhead. Do you see any other issues? Oh, I could think of one other too. We have all these people coming out from New York, and some may be actually in quarantine status. Either they've tested positive or they have contacts with somebody who's tested positive. We're not being told, right? We're not being told those locations. So how do we monitor possibly if they're staying and adhering to the requirements of that quarantine? I've said a lot. Those are just some of the East End issues. I'm sure some of these things are going through your mind. Let me kick it back to you.
Good. So Supervisor Schneider makes a lot of good points. But I think what we need to communicate to those watching and to our community is that while monitoring is important, it's really not the most important thing. On the call we were on with Dr. Piggott, the commissioner of the Suffolk County Department of Health, he also mentioned there was 297 tests. So out of those 74 people who tested positive, there were only 297 tests. That means about 25% are testing positive. But that means that of everybody in this county, only 297 tests were administered, which means there's probably a lot more people walking around that would have tested positive if those tests were available, which is why all we can do at this time is isolate ourselves and social distance and to make sure that our seniors stay inside. That's the message. There's one message, one takeaway today. Seniors need to stay inside. And we are here to work for you if you're a senior. We have volunteer programs set up to deliver food or any necessities needed, so we can reach out to the senior community about what that entails. But I would just caution that for the average person that might contract this, according to the CDC, you'll get through this. It's going to be 2 weeks, but you'll probably be fine. You might have a fever, you might have a cough, you might have some flu-like symptoms, but the average person is going to be okay. The seniors and those with pre-existing conditions are more compromised. And so that's where I'd have to warn everybody. where seniors need to be especially careful. But at the same time, if you're a millennial, if you're a baby boomer, if you're Gen Z, you're still at risk. And if you look at France, for example, their ICU has also many people who are all across ages. So it's not just for seniors, even though seniors need to be very careful. But going back to that point, do what you can to protect your community. Do your part, which is to isolate and social distance when you look at those numbers.
Well, let's talk about seniors for a
Yeah.
second, because we have a higher proportion of seniors than is typical based on the census data. So how do we keep those seniors safe? They need food. I guess they can do Peapod or one of those food delivery services. But if they go out to Stop and Shop or wherever to get their food, and now you have the cashier and you have money being transferred, and they might need to go to CVS or a pharmacy to pick up medicines. Is there more that we could be doing to assist them in staying at home, being able to maybe have some sort of service where we could get things for them or pick up things for them? Is that something you've thought about, or is that a role that we in government can play?
I think we can. I mean, while we have a role of being an elected official, or we're also public servants, and we also everyone really needs to do our job, whether you're employed by the community or not. And a lot of people have reached out to me. You mentioned there are a lot of people from New York City that are out here. Whether you're from New York City or not, a lot of people who are homebound, who are healthy, have asked me if they can help out. So we had this idea where we're going to basically be reaching out to our senior community. We're reaching out now as well. And you can call us or email us. And if you need something, we can bring it to you. Now, we're not going to come into your house where we don't want any exposure to you. We can essentially leave it at your doorstep. We're going to focus on shelf-ready items. We don't really want to be dealing in the food.
So this is something you're doing within the village?
Well, I'm definitely doing it personally. I would like the village to help out as well. But basically, it's...
Is there a number that people could call if they want to take advantage of that offer?
Sure. Well, first off, you could email mayor's office at southamptonvillage.org. You can call our village number, which is on our website. You could even call me personally. We'll maybe let our seniors know what numbers to reach. But for now, you can call Village Hall and Mayor's office. I'm comfortable having people call me personally. That's the job that we need to do. And our volunteers are also going to be available for contact. And interestingly, we actually had a really widespread number of volunteers who wanted to step up, but not so many seniors have contacted us, possibly because maybe our senior community is not getting the message. And so we're actually going to be, we're going to have some free time. We're going to be calling our seniors through our volunteers. We're going to reach out to them.
Are you taking any personal precautions, as the mayor of the community, to try to avoid getting coronavirus? I know the county executive, as you know, right now is in quarantine because one of his senior staff members did test positive. So the county is sort of being run from, County Executive Ballone's home office. It's obviously easier if these people in executive positions don't contract the virus. Obviously, if they do, we can make adjustments. But are you taking any personal measures to avoid getting coronavirus?
I'm just trying to do the exact same thing that everyone else should be doing, which is social distancing. We're probably a little bit too close here, but just to illustrate that point, and isolation when possible. But I still want to be doing my job, and there are other elected officials who actually have contracted coronavirus. I know the mayor of Miami actually has coronavirus, and he's working remotely. So I'm doing everything I can not to contract the virus, but it's almost out of our control unless we are strictly isolated and social distancing. I'm of course washing my hands probably over in a really high amount. So what I've heard from the CDC is actually soap and warm water is actually the best thing to do. So I am washing my hands frequently. and I am social distancing and isolating when I can. But of course, I'm going to be, going to places I need to go to. But I'm going to try not to do that. I'm not going to let the fact of a certain title make me go against any, guidelines by the CDC.
So, looking ahead to when coronavirus is in the rearview mirror. A lot of people don't know you yet. You're the new mayor. Could you just talk about when we get past this and we can talk about other things other than coronavirus? What are some of the things that you hope to get accomplished as the mayor of Southampton Village?
Well, here's actually a good transition. We're going to still have our village team working on what we were elected to do in the first place. And one thing we spoke about is a sewer system, which is good for business development as well as clean water. Now, the interesting thing is that we had mentioned there was a positive test in Suffolk County. Our liaison to our sewer system was the person who was confirmed. And so ultimately, again, there's a lot of people are going to be testing positive. I mean, this is not going to be a one-off or two-off thing here. And so that's essentially the transition here, where ultimately a sewer system is a top priority for us. We're going to make sure throughout this crisis, we're going to work with H2M, who is an engineering firm. When our attorney has time, we're going to be working with our new attorney on the legal formation of a sewer district. I'm going to be reaching out to Lake Agawam Conservancy. Lake Agawam and clean water is a big priority for this administration. And there's probably some members that probably have some more free time at the moment. And we're going to make sure that we are really focused on this. We have our budget coming up. I don't know if the village budget is the same fiscal year as
you have village
town.
Elections coming up too, right? Is that
in June.
Yeah. So I don't know if that may end up getting delayed too. I don't know what the rules are going to be, but that creates a problem, people coming together. Let's hope this is behind us by June, but we don't know. Can I ask you, one of the things that you have in the village is a hospital. And I know there are plans to move that hospital outside the village up to the, likely to the campus of Stony Brook, Southampton. And I'm sort of going back to coronavirus again, and those are all things I want to help you with in terms of improving water quality in Lake Agawam and getting that sewer district going. And we may have some funds available through our community preservation fund that can help assist you. And I really want to work together with you and your board on moving that agenda forward. But you do have the hospital here. Have you been in touch with the hospital? Do we know to what degree they've been able to ramp up with both testing and ICU beds and ventilators and things like that? Have you had any contact there?
We had some contact with Robert Ross, who's the head of public relations and community relations of the hospital. And what he has told us is that as of now, the hospital is in good shape. They've got their beds, they've got their respirators. But one thing actually is really important that he has mentioned to us, which I think it's important for us to communicate today, is that if you are feeling like you have some symptoms of the coronavirus, whether you have a fever or a cold or flu-like symptoms, don't just show up at the emergency room because they won't be able to help you. You need to first contact your healthcare provider. You need to first contact your doctor, your urgent care facility, and then you should call up the hospital and let them know that you're coming, because they have very strict protocols due to safety standards as to what they can do. So if they know you're coming, they can then test you. But if they don't know you're coming and you just show up at the emergency room, you actually put the hospital at a disadvantage. So I think what's very important is that our residents need to know that first call your doctor, make sure you fit the qualifications needed, and then give the hospital a heads up that you're coming and don't just show up.
Yeah, another thing, that's great, and I thank you for that information. I think it's really important. In addition to having a hospital in the village, you also have a supermarket and other places too, where people can get basic food supplies. I was in the Stop and Shop the other day. A lot of the shelves were emptied. We did reach out through Councilman Bouvier, one of the town board members, to Stop and Shop, and they have assured us of adequate food supplies and food deliveries. In fact, they're upping their deliveries, so they're restocking all their shelves. So I know people are concerned, and we're going into sort of a hoarder mentality. People are knowing that they're going to be at home for extended periods of time, but we're being assured that there'll be adequate food supplies, and for people not to panic, and those shelves are being restocked, and it's important for people to know. Any thoughts along those lines in terms of supply chains and food?
Yeah, it's a good question, Jay. I mean, I learned that Stop and Shop is doing something very communal, and I believe we'll have to go check on their website and their social media channels.
Yeah.
I think they're opening early and only for seniors. Not going to ID anybody, check anyone's age, but if you feel like you fit in that criteria.
Early is what time, do you know?
I have to go find out. I know it's maybe an hour earlier than usual, but it's available on their website and their social media, and I think that's a nice thing that they're doing.
That's good. We'll try to get more information, and we're going to use Channel 22 as a sort of a central location for information about the coronavirus. That 24 hours a day. We'll probably have you back on as more information develops. I know Assemblyman Thiel will be on. County Legislator Fleming will be on. If we're able to get somebody from the hospital on, I don't want to pull them away from the work that they're doing, but we really want to use this Channel 22 as a source for local information about coronavirus. There's lots of national information that they can get on CNN or wherever they tune into, but we have this resource on Channel 22, Community Access TV. I want to thank CTV folks, because they would probably like to be home as well, rather than sitting here and filming us and editing and getting this information out. So I want to thank everybody at CTV for doing this. And the message again is stay home, stay safe, and I guess we'll add to that, stay tuned to Channel 22 for information. They can also, and I've said this before, they can dial 311. And there is somebody who will pick up the phone if you dial 311. This is a county hotline type of number. It's not the emergency number. Emergency number is still 911, but 311, you will get an actual person who can answer your questions regarding coronavirus, or attempt to get you the answers or direct you to the services that you may need. So that's a really important system that County Executive Bellone has set up. So take advantage of that. We have information at our website, and I'm sure you do on yours. So the southamptontowny.gov, I believe, is the right address. We'll put that up on the screen. So go there. We're doing updates through the Code Red system, and I know you're doing that as well, Mayor Warren. But a lot of people, I sent out a message yesterday, a lot of people got it, but not everybody. So if you're not getting that message, you're probably not signed up for the county's Code Red system. It's easy to do. So you can just Google Suffolk County Code Red, or we'll try to get that that link here. You go online, you register. You can register as a guest, or you can give them all the information. They'll send you texts, they'll send you emails, they'll send you phone messages. I did it yesterday. We sent out a text and we sent a phone message. We'll continue to use that alert system. There's also something called Notify Me. That's a different system within the town. You can get to that through the town's website. Jesse, you're using Code Red 2 within the village, and you've sent out one message, I believe, already. You want to say something about that?
That's right. So we're all using this Code Red system. If you want village-specific messages, you can text Southampton to 99411. Again, that's 99411. You can text Southampton to it. But it's one communal system. So I got your message last night. I wasn't sure who was calling. I picked up. It was an 800 number. And it was Supervisor Schneiderman giving us your announcement, and thank you for doing that. And the goal is just to provide real-time updates. So it's a good resource to have. and it's a good resource to have now during the coronavirus situation, but it's also a good resource to have throughout the year. If there's flooding, if there's a family, a missing child, anything like that, this is what that system is for. So we would just recommend that if you're not on it, you should just sign up for it, and either via website or via the app on the App Store. It's a great resource to have.
Again, I also want to remind people, though, although restaurants and bars are closed, you can do takeout. I even think you can do takeout drinks. I think that's something that the governor is allowing. We do want to keep these businesses in business. These are going to be very hard times, so support your local merchants. You can get food delivered. Restaurants are offering that service, not all. There'll be takeout offered. So we want to have this minimize the economic impact as much as we try to minimize the spread of this virus. But we're going to do frequent updates on Channel 22. So Mayor Warren, I'm not going to shake your hand because we're going to maintain social distance, but I do appreciate you coming on and letting the folks in the village and throughout the town know some of the steps that you and your board are taking to protect public health. I want to thank you for watching Talk of the Town, the special edition. And again, stay home, stay safe, and stay tuned. We'll see you soon. Thank you.
Thank you as well.